Welcome to Ethics in Patient Safety Communication. Effective communication of risks in healthcare settings is challenging yet critical to maintaining patient safety and trust. Ethical patient communication ensures transparency, autonomy, and the protection of human dignity while encouraging informed decision making. Foundational ethical principles in communication: autonomy, respect for the patient's right to make informed decisions. Example, providing drug risk information for patients to consider alternatives. Non-maleficence, to do no harm by ensuring the communication approach doesn't mislead the patient. Example, avoiding exaggeration of a risk to prevent unnecessary anxiety. Beneficence, to act in the patient's best interest by clarifying complex medication information. Example, explaining infection risks of surgery while offering preventative steps. Justice, fair communication standards for all patients irrespective of background. Example, translating risk information into multiple languages for equity. Some strategies for effective risk communication. The goal is to communicate clearly, thoroughly, and respectfully while avoiding misunderstandings. 1. Establishing clear objectives. To define the purpose of the communication, whether to inform about potential risks, to request behavioral changes to minimize harm, and to correct misinformation. Example, informing patients about vaccine side effects to increase acceptance while addressing common concerns. 2. Building trust. Be honest. Acknowledge uncertainties while presenting the best available evidence. Apologize when necessary. Patients respect institutions that accept responsibilities for mistakes. Case in practice, a hospital informs a family of a preventable medical error and includes steps taken to prevent recurrence. 3. Tailoring information. Use layman's terms to ensure understanding. Avoid excessive use of medical jargon. Provide visuals like charts to explain complex concepts, and to match context to the patient's literacy level. Example, explaining cancer treatment risks by using simple language and illustrations. 4. Listening and addressing concerns. Actively listening to patient concerns and to respond empathetically. To offer reassurance by providing evidence-based solutions. Interaction example, when discussing surgery risk, a surgeon invites and answers patients' queries about anesthesia safety. 5. Using multiple channels to combine verbal, written, and visual communications for effectiveness. Example, providing post-care instructions verbally as a printed guide out. Cultural sensitivity. Respecting patients' cultural beliefs and their impact on risk interpretation enhances trust. Example, adjusting risk communication for patients with strong traditional health beliefs to align with their values and to help maintain long-term trust. Trust develops over time and depends on consistency in communication standards. Some tips to sustain trust. Deliver timely updates on patients' conditions or health risks to avoid conflicts of interest in communication. Some common ethical dilemmas in risk communication between balancing transparency with patient anxiety. Provide truthful risk information but frame it constructively, highlighting solutions and supportive care. Incomplete or evolving data. Share updates as they become available without waiting for perfect information. Misinformation management. Actively dispel myths with facts delivered empathetically.